All right, well, we're with Zachary McLaughlin. And Zachary, I'm going to ask everyone to start off with the very first question of who you for.
I'm Zach McLaughlin for Jewel, Lindsay. You know, coming from a long line, McLaughlin's also from Ray McLaughlin, up in Bodden Town. My mother from West Bay, father from Bodden Town. We lived all over the island a long time. And then I left the island back when I was 15 to go to high school. Um, did some things down there for a little bit, graduated, went to college, joined the military, traveled around the world a little bit, Hawaii, Germany, Italy, and now currently I'm living in United States in Oregon.
Okay. And what's the COVID situation like over in Oregon?
It varies day by day. We got people that are unvaccinated, so we are all running around wearing masks when we go out. Um, the the sick people are coming into the hospitals here and there. It goes up and down. I think, just went on lockdown like 2 weeks ago, where we weren't allowed to congregate in areas or have parties. But they're slowly trying to ramp it back down, but it changes day by day.
So who's that little one next to you? It looks like you have something to say.
Yeah, this is one of my youngest. He's a twin named Frederick McLaughlin.
Something. How afraid of you? How afraid are you of COVID because you got young children?
Um, we're afraid, but not enough that they mobilize us or anything like that. We keep vigilant, treating it just like most diseases and stuff that are out there. We take precautions. We make sure we keep washing our hands. We wear masks whenever we go out. Myself and my wife have both been vaccinated. That's for us, the kids, as well as some family members that are immune compromised, that we're watching out for and want to help make sure that we keep them safe.
And what are some of those other things that you do? Do you go to the restaurants? Do you kind of still hang out with friends? Are you able to pretty much live your normal life just with some added health precautions?
We do, yes. We wear the masks whenever we go out to any type of huge areas with crowds and stuff like that, and we take hand sanitizers with us in order to keep clean. Children get into anything and everything, so we have to watch out for them and make sure that they're not putting stuff in their mouth that they're supposed to. But we take this similar precautions as you would as if it was flu season. Wearing masks, washing our hands more often, watching out for them. Whenever we do go to restaurants, we'll wear a mask till we sit down, and whenever we're eating, we'll take it off. But for the most part, we just following what the regulations have been put upon us and keeping track of it.
Mm-hmm. And in Cayman has a really good vaccination rate. It's somewhere over 70%, but there's still more people that need to be vaccinated. What would be your message to those who are not yet vaccinated?
To my fellow Caymanians, I'd say get it, man. Yes, there's all kinds of things that are going on, but make sure you do your own research. You have to research your own stuff. You can't take someone else's word for it, because I could tell you the sky is pink, and if you don't go ahead and go look and check, then you're gonna think it's pink. But it's up to you to go ahead and look out there and check and see what's going on and what's the best benefits for you, your family, your friends. All of us want to get out. We want to be able to go back to our normalcy, but it takes time. But it's up to everybody to do their own part and their own research to figure out what's going on and what's happening.
And there's other people out there that Cayman was they're going to open up at some point in time. And when Cayman reopened its borders, some people are so afraid that they're saying Cayman shouldn't open its borders. But like, I'm here in Florida, you're there in Oregon. We have COVID pretty much all around us in our community. We're able to live our lives. What would be your message to those who are afraid of Cayman opening their borders?
We can't be afraid of everything. We have to take the precautions. If we take the right precautions, I believe that we can go ahead and continue living a normal life. It takes time to build up to that. And once people decide that that's what we're going to do in order for our livelihood, especially down in Cayman, because it's tourists, we need tourists to come down and help us out. It's going to take that time to do that. So I just want you guys, as a family, as a country, we have to take the time in order to figure out how we're going to do that and what we need to do in order to facilitate that. If you think about this, it's not the first time this has happened. We've had diseases all the time coming from different places. This is just a different bit of a different transition of it and how it's being transmitted to people. All right. So once we find the right precautions and the right medications that we need, then we go forward and do what we need to do. But to survive, we have to figure it out together.
I really appreciate you taking the time with me, Zachary. All right, take it easy, man.
No worries. Anytime. Thank you, guys.
All right, folks, good evening. Thank you guys so much for tuning in. Just a little segment there on Caymanians who are living abroad with COVID. We'll have a number of those interviews that we'll be injecting into both the morning show, the special COVID series that we're doing, the COVID Spotlight series. And we're absolutely delighted this evening. Let me first introduce Kevin, who's going to be the primary host for this segment this evening. Kevin, good evening. How are you?
Hello, good evening, good night, everyone. Actually, I hope everyone's doing well.
On the light, Kevin.
Yeah, I'm wondering why you're inside the dark, Cargo.
There we go.
Yeah.
So how are you?
I'm doing good. Today was a really busy day at work today. I got a call saying that we're going to have the governor of Florida over at my health department, and I had to quickly put together a press conference. So it was a pretty busy day. And of course, right at the same time my press conference was going on, I saw the Cayman Islands also had a press conference going on where they put out some data. It looks like, just to highlight some of the stuff that I saw, it looks like 77% of the population has had one dose of the COVID vaccine, and 72% had both doses. And so they also said that a handful of booster shots have also been administered so far. So, we're getting those numbers moving up, which is definitely excellent that we're getting higher numbers. I hope we get to that 80 to 85% within the next month or so. That would be awesome.
Absolutely. So Kevin, we know that you've got a special guest lined up. You've been in charge of the programming for the COVID Spotlight series, which we're going to be doing at least for the next month, every Tuesday and Thursday evening. And I know people are not used to us being online during the evenings. So I can see that our numbers are a little bit low, but the good thing about this is people can always go back later and watch these. So we hope that people take advantage of the just plethora of experts that you put together to really try to educate people on everything related to COVID. So why don't you go ahead and introduce your first guest for us?
Absolutely. So the topic for tonight would be the current situation here in the United States as well as around the world, as well as the role of an epidemiologist and contact tracer. So tonight we're going to be talking to Mike Wiese. He is the epidemiology program manager for the Florida Department of Health in Hillsborough County. He's the epi chief that I actually go to for a lot of the data that I'm involved in, and he oversees reporting disease investigations, surveillance analysis, as well as he also manages our county's case investigation and contact tracing team. So yeah, we could bring on Mike Wiese. Mike, good night, and how are you doing?
Hey, good evening, everyone.
Hey, Mike, thanks so much for joining us. Good to have you on.
Not a problem. Yeah, happy to be here.
So tell us a little bit about, I'll start with the first question. I know Kevin has all his questions ready, but what is an epidemiologist? It sounds like such a big fancy word, but what is it?
Yeah, that's a great question. So, epidemiology in itself is a science in which we study the way diseases or different types of health-related states are spread throughout a population. So, and then we use that information to actually try to improve the health of the people that we're focusing on. So in Hillsborough County, that's kind of the population that we typically focus on in Hillsborough County in Florida. And my job is to really collect that information, the data, so that we know the diseases and how they're spread throughout our population in order to make them healthier. So that's really what an epidemiologist does.
Very good. So you've got a lot of information available at your fingertips, basically.
Yeah, absolutely. We rely on a variety of different surveillance and data tools to keep track of this information and collect it. And then we we use that information to really try to make people healthier, help people make better decisions, help guide their health and well-being.
Yeah, one of the ways we kind of describe it sometimes to people are, you know how you have regular detectives in the police world? Well, he is a detective for diseases. He goes out there and investigates those diseases out there. And of course, when COVID popped up, that's just one of the things out of many other things, even in addition to just COVID investigations, there's other stuff still out there. So he still has to really, keep an eye on a lot of those other things that are out there, him and his team and the others throughout the whole entire area as well. But yeah, Mike, one of the questions I wanted to kind of get clarified, because there's a lot of people out there that say, I might get COVID from this way or that way. How about we hear it from you? How can you get COVID?
Yeah, so COVID is a respiratory illness. So it is a virus that lives within the respiratory tract, your lungs, your throat, your nose, and that's where it goes into the human body, and that's where it likes to be and reproduce. And the way it spreads is once it's in someone's respiratory system, when they cough, they sneeze, and unfortunately, when they just breathe and speak, that virus can come out of their body, and someone else can breathe it in. That's really the primary way that we see COVID spread. It is thought that the virus can be breathed out and be kind of in the air around us, and that's we'll talk about contact tracing, but understanding the way that the virus spreads is important to how we're going to identify who might get exposed to the virus. And so really that's the primary way it spreads is through those coughing, sneezing, talking, yelling of someone that's infected with the virus, and then someone else breathing in that virus.
So some people I know are saying, well, I probably got COVID from things like gas pumps, door handles, other high-touch surfaces. Like, what's the likelihood of that happening? Yeah,
we really don't see that that surfaces or food items or things like that are a major player in the way that COVID spreads in the community. The virus, when it lands on something like a gas pump or something like that, it doesn't really live for that long. And most of the time when you're touching that type of stuff, it's just on your hands, your fingers. It does not get into your body that way. It is why we tell people to remind themselves to wash their hands. You don't want to be putting dirty hands anywhere. But really the main way that the virus spreads is by being around people that are sick and breathing in the air from someone that's infected. We don't really see transmission occur really in almost any other way in any significant numbers.
That's very interesting. And of course, with COVID, you've got two categories of individuals. You have individuals who are visibly sick, which we would call symptomatic individuals. And then you have asymptomatic individuals. Do we know what percentage of people with COVID actually fall into the asymptomatic category?
Yeah, this is a really interesting question and one that actually the science has changed over time with this. So really, at first, we didn't understand that ratio at all. And we really kind of thought that someone could only really spread the virus or have the virus and they would have symptoms. Then we learned early on that maybe as much as 20 or 30% of individuals that had caught the virus didn't have any symptoms. So there was actually quite a significant number of people at one point we thought were asymptomatic, had caught the virus and never gotten sick. But as we've seen newer variants emerge, that ratio again is seeming to change a little bit. And actually with some of the newer variants like Delta, they actually are starting to think that the asymptomatic rate's actually a little bit lower with a virus like that. So it's still possible. It's still very much something that we see where someone gets the virus into their body. They could test positive on a test, but never develop symptoms. It's certainly something that occurs. But actually with Delta variant, which is in Florida, the variant that we see the most of with COVID, the majority of people actually right now are developing symptoms.
That's very interesting. Kevin?
Yeah, so I know there's a lot of people that were afraid of the mu variant. I know it started to kind of pick up a little bit of news traction, not hearing about it quite as much. I know there's been some cases identified in our neighboring country in Jamaica from the Cayman Islands, Mike. And I know one of the things I'd asked you, how concerned should a lot of people be with the mu variant?
Yeah, the understanding variants, it gets very complicated very quickly. And so I'm going to do my best, but variants occur because there's lots of different types of proteins, and the structure of the virus is actually made up with different types of proteins. And based on the way that those proteins have changed or evolved, if they change in a significant way, enough that it's different from its ancestor or where it came from, then we start calling it a variant. And so these things are happening all the time. The viruses are constantly changing. And we really only start kind of watching it when it starts to have characteristics that appear to be different enough to change either the clinical presentation. So maybe someone gets sicker because of this change. Maybe someone gets sicker for longer or quicker. Maybe it actually is a change that makes someone who's been vaccinated not respond to this now type of the virus. And we've seen different parts of different viruses have some of those characteristics, but not all of them. And with the mu variant, the characteristic that has become concerning for scientists studying it is it does appear that it's a virus that escapes the vaccines that we've developed right now. Having vaccine immunity from someone who's gotten vaccinated may not protect you as well against this variant. So just because the virus has that characteristic doesn't really tell us a lot about whether it's going to show up in large numbers or even, really play a major role in any one city or jurisdiction. So I like to look at, what these are doing over time. And right now, this is a very new variant. We're certainly monitoring it, and I'm sure every jurisdiction, at the state, national, and global level is kind of paying attention. And it really comes down to, does the variant have enough of a characteristic that starts allowing it to spread from one person to another in significant numbers that really have to change the way that we're thinking about it? And that's, to go back to the Delta virus, the reason it became such a big news story is because it was able to displace the variant we had before. It overtook previous variants and kind of pushed it out of the way and said, I'm the only one that's going to spread around anymore. And so now we had to deal with the fact that it was the one that was spreading all over. I personally don't think we've seen enough to show that the mu variant has the capability to do that, but that's what epidemiologists like myself and lab technicians are doing, is paying attention, seeing if we do see that those numbers, it shifts in any way. And, you'll certainly hear from the public health community if there is a reason to become more alarmed. But we're really in kind of a wait and see scenario right now with the mu variant.
So one of the things, there's a lot of talk out there, and I just want to make sure that we highlight it as well. People saying, well, individuals who are vaccinated, this is kind of a breakthrough question. People that are vaccinated are still getting it because the Delta is just that powerful. So why should I even get vaccinated? What would be your comments on that?
So absolutely, the understand with vaccines that we've invented or developed incredible vaccines against COVID. They are among the best response that we've seen of any vaccines that we've really developed throughout vaccine history. But we've never invented one that's perfect. And so no matter what vaccine we've come up with, there's always a chance that a couple of things happen. One is that it isn't completely a perfect match for the virus that it's meant to protect, which allows some level of virus to occur in an individual. And in other ways, sometimes the individual, so the vaccine itself works, but the human that the vaccine gets injected to doesn't create enough of a response to that vaccine to protect themselves if the virus comes into play. And with coronavirus, we have a little bit of both of those things going on. So when you're fully vaccinated, an individual should have had a robust response, but we do know that people have complicated medical situations, different backgrounds. They may be taking drugs that suppress their immune system. They may be elderly. For a variety of reasons, they may not have responded to the vaccine. So despite, on paper being protected by the vaccine, their body really didn't generate a response. And so, they may catch COVID even though they've been vaccinated. And then with that other point, is we know that the vaccine isn't 100% match for all of the different variants that are kind of out there. And so there is always a chance that, the virus comes into the body and kind of overwhelms the immune response. And then that eventually causes that individual to get some symptoms and become sick. So those are the reasons that the vaccine appears to kind of fail, if you will. But really, when you look at the bigger points, which I would say hospitalization or the most severe outcome, death, even in individuals where one of those scenarios happen, where they don't have a strong response or it's not a perfect match, we still see that it reduces their chance of hospitalization by over 20 times. So someone that's vaccinated, someone that is unvaccinated is 20 times more likely to get hospitalized if they catch COVID. And then with death, someone that's unvaccinated is 20 times more likely to die if they catch COVID if they're unvaccinated. So the vaccines, despite occasionally still allowing someone to get sick, are just incredibly powerful tools at preventing the most severe illness and ultimately death. So I would just point to those two figures right there as the number one reason to get vaccinated.
Yeah. And we hear those figures, Mike, and tell us how significant those figures actually are. Some people might say, oh, well, 20 times, that's not a big deal. How significant is that, though, really?
Well, I mean, when it comes to a hospital system, for example, in Hillsborough County, we have a huge hospital system. We're lucky to have tons of hospitals, but we really have about 1,000, 1,200 inpatient beds. And if you're looking at a population of 1.5 million people like Hillsborough County, the difference between our emergency department being completely overwhelmed with individuals because none of them are vaccinated, or if you reduce that by 20 times, we just wouldn't be able to handle the surge of individuals that could end up being hospitalized. And then when you talk about like ICUs, ventilators, those specialty care items, those are even harder to come by, even in a location like Hillsborough County in Tampa, where we have a lot of resources. So it's just absolutely vital to allow a country to function. You need to make sure you have vaccinated individuals so that you have enough supplies to care for those individuals that either are choosing not to get vaccinated or for one reason or other, they can't get vaccinated. And those are certainly the people we want to protect the most.
Is there such a thing, and I'm sure you've studied other viruses, Mike, is there such a thing as any vaccine being 100% effective? How do we eradicate other diseases? Like, how did we get there? Is it just because of the high vaccination numbers, or was that particular vaccine 100% effective or somehow better?
Actually, I'm sure we're going to transition to contact tracing, but it's a combination of the use of vaccines that are very effective but not perfect, and then aggressively doing case identification and contact tracing when those cases occur. So for illnesses like smallpox, polio, measles, that we've really done a great job in the United States of either completely eliminating or nearly eliminating, it's a combination of the use of vaccines with a strong public health system to identify cases and identify contacts and make sure that you stop the transmission chain for those diseases.
Right. So let's perhaps, Kevin, this might be a good time to transition a little bit.
In the contact tracing, what is it, Mike? I know people hear the terms, but what exactly goes into contact tracing?
Yeah, so just kind of like I touched on, the idea behind contact tracing is that we know someone that's infectious could spread the virus to other individuals. So looking at a disease like COVID, we know when someone catches the virus, they could be contagious. They could possibly spread that disease to someone 2 days before the virus gets into their body, up to 2 weeks after. So they have a long period where they could be possibly spreading that virus to other individuals. And so during that time that they're possibly infectious, we look at where they may have gone, the people they may have interacted with, and we identify those people and we remove them from going around town and possibly spreading the virus further. So the entire idea is that you kind of stop the chain of transmission at that person that got exposed. You quarantine them, which is the term we use for putting people that don't have symptoms yet kind of in a room at home so that they can't spread the virus further to others. So contact tracing is kind of one of the oldest tools in public health that's been around for a very long time. And it really works best when you get full cooperation from individuals that give us good information about where they went and who they might have exposed, and that those individuals that we are notified of, cooperate with our instructions and take the necessary precautions to prevent further transmission.
Yeah, and I wanted to kind of expand on that, discuss the cons, the pros, and some of the challenges of contact tracing. But right before that, I just want to reach out to our viewers. If you're watching, please share it on your Facebook page, your Twitter, any social media site that you have. We want to make sure more people are watching this and being able to benefit from this information, just like you are as well. We're almost at the halfway point in the show or so we want to make sure that we at least push it out as much as possible, and tag all your friends to be sure to let them come and join us. But back to you, Mike, with contact tracing. Discuss the cons, the pros, some of the challenges of contact tracing.
Yeah, so contact tracing, one of the things that works really, that's very important with contact tracing is that the person that's actually infectious takes the time and is forthcoming enough with the information that we can act upon. So the person that's infectious, we can talk them through. We need to know where you were from, September 1st through September 11th. Can we go through each day? And, if someone is very open and honest, they might give us their full schedule. They'll tell us they went to work that day and then they went to the gym. And then other individuals may just say that they don't want to share that information. They don't want to give it to us. So, really, to start contact tracing, you need the help of the person that's sick in the first place. That person that's infectious needs to be cooperating with us and providing that information so that we can act upon it. Without that, the next steps are really impossible. So if we get someone that's cooperating and the majority of people do want to help and provide that information, but then you could hit the next hurdle, which is those individuals that are identified as possible exposures, people that were identified by the case. We also then are kind of need the cooperation of that person as well. So we need them to understand the situation, agree to remove themselves out of a situation where they could possibly spread it to other individuals. And then, of course, if they're sick or if they need to get tested, that they follow through on those types of recommendations as well. So we really, in public health, this is us working with the community day to day. Like, we need the community to have buy-in and understand that this is a tool that helps us, limit the transmission and allow everyone else to have their day. It's how we kind of get through the pandemic.
One of the things I know that happened actually to us and a lot of other places is contact tracing became just too overwhelming because we just had too many cases and not enough bodies to do it. Because how long does it take for one person on average? Is it almost an hour or so per person or so?
Yeah, it varies, of course. If you talk to someone that got sick that's in their 20s and they have 3 jobs and they have 15 different friends they hang out with every week, those investigations can take hours to compile the entire list of places and people that they interacted with. And then what you're left with to follow up is maybe 200 names of individuals based on one individual case that you need to follow up on. And then other cases, maybe, a retiree that, didn't really leave the house that much during the course of their infectious period. So it really can vary, but as you can imagine, for example, in Hillsborough County during some of these waves of COVID, we've had over 1,000 cases per day, almost 2,000 cases per day. And each one of those cases taking on average an hour or two to investigate. That's thousands of man hours to get through that casework for just that single day. And we're talking about just the cases, not even the contacts at that point. So at a certain point, the resources that are demanded to be able to handle that, most jurisdictions, when the wave of illness is that size, won't be able to handle fully contact tracing when the demand gets that severe. So that's really why we also try to use other mitigation and control measures out in the general public, like mask use, limiting crowd size, telling people to social distance, and then once vaccines became available, really encouraging people to get vaccinated, because the contact tracing tool, when it is effective, is mostly when numbers are lower. The higher the numbers get, the more that we really need to rely on those other control measures or mitigation measures.
And absolutely, those who are watching us too, if you have any questions for Mike, go ahead and write it in the chat. We'll be monitoring. I know Sandra's kind of keeping an eye on it. So Sandra, feel free to jump on in if you see any questions that come in. But Mike, what about living around COVID? How can we do that? I know you kind of touched on that, especially, some of the social measures that public health officials recommend. But how can we live in a world with COVID all around us?
Yeah. Well, number one, if you're not vaccinated, go ahead and get vaccinated. That is the number one thing you can do to just reduce your individual amount of risk. That way, if you do unfortunately catch COVID, you're at a much lower risk of having to go to the hospital and a much lower risk of ultimately dying. So just right out of the gate, get vaccinated. After that, the logical steps that you want to think about are, as we go back to the very first question, this is a virus that spreads when an infected person is breathing. So if you go into places with lots of people and you're very close to them, that is an environment in which you can possibly become exposed. The more people, the more likely there's someone there that's possibly infectious. So limiting your attendance at extremely large gatherings, or especially if those gatherings are in close indoor environments where there's poor air circulation, those are the types of things that you should generally avoid while COVID's circulating. And then if you do want to go into those types of settings, using those other control measures, try to keep 6 feet from individuals, and wearing your mask are the best other things you can do if you do have to go into a crowded grocery store, you want to go shopping or things like that. You can do those things if you maintain social distancing. You kind of go at off times when it's not nearly as crowded, and you wear your mask when you go to those places. Those are pretty reasonable steps that allow you to basically go about most of your activities throughout the day without much of a change. Right.
And Mike, I've been reading lately that there's this thinking now that we will all get COVID at some point. It's going to just, go through the human population. And so I think, as you said, the best line of defense is to get vaccinated first and foremost. Where do you see this going in terms of a pandemic? I'm guessing this is the first major one in your lifetime that you've had to deal with.
Yeah. I'm not quite old enough to be around for the 1914 flu. But yes. So yeah, this is, has all of the characteristics of a virus that's capable of sustaining itself within the human population. We're just such a global world that the illnesses that are occurring across the entire planet are intertwined. And so until enough of the world either is vaccinated or gets the virus, through infection, we're really going to see it circulating throughout the world. And so while it's circulating throughout the world, it has the chance of getting reintroduced into any community. So realistically, I think it's fair to say it's something that we're going to be living with in some capacity for the coming years. I think the science and the experts that look at viruses are kind of still a little mixed on what the long-term beyond 1 to 2 years looks like. There's some thought that the virus will kind of continue to mutate, but because of the illness or vaccine protection we have, future variants will really kind of turn into common cold versions of coronavirus that would, come through like we're used to of getting a cold every winter. So there's some people that think that. There are actually some people that think that the current strain of the coronavirus after a few years will eventually kind of just burn itself out. The entire world will be either vaccinated or catch it, and it will just kind of fade out, and we won't see anything that looks like coronavirus, COVID anymore. We have other types of coronavirus, but not COVID virus. And then there are others that think that there's a chance that the mutations might be significant enough to cause severe illness, in pandemic waves, every few years. And any of these things, I'm not going to put money on any of them, but I think they're all forms of what the future might look like. And what we know right now is that the virus that's currently circulating, we have good vaccines for, and we're learning more and more about it each day. So kind of swinging off the question a little bit here, but we've developed a few treatments like monoclonal antibodies that are more effective at treating it. And so I do think that, to go back to the question, we'll kind of come to a comfort level with taking precautions and having treatments available, and kind of learning to live with the slight risk of COVID in our lives for the next few years. And that's my kind of perspective on the situation.
And as it continues then to go through the human population, does contact tracing become a thing of the past, you think? Or, will we continue to contact trace in the way that we are currently?
Right. So, yeah, that becomes the kind of question that public health agencies will have to review. So the value of contact tracing is that we stop the chain of transmission, because we think that interrupting someone's life and asking them to quarantine, we think that restriction on that individual outweighs the risk that they would pose if we let them go about their life. So as more people are vaccinated, as we have treatments or it becomes less severe for individuals, that ratio shifts, right? So it becomes less appropriate to remove someone from their life for 2 weeks for an illness that might just now be causing common colds. We don't tell people they need to quarantine for 2 weeks because they have, a cold, a normal year-to-year cold. Because it doesn't justify the risk. Would it stop them from spreading it to other people? Sure would, but it doesn't have enough of a public health impact to justify that. So I think as the virus moves through the communities, and public health can evaluate the impact that the virus is having, those types of recommendations will certainly shift and change, and we'll figure out what the correct balance is of controlling people's movements and allowing them to move freely to prevent the spread.
Now, Mike, tell me something. Do you think, or like, how likely is it? I know we've had I believe it was three big peaks. Is that something that has a good chance of happening again, especially or based on vaccination numbers throughout the world? Is that less likely? Kind of where are we with that?
So there's going to be a few major factors that will drive whether in Florida or any place sees additional waves. The vaccine is one way you're going to get immunity, and the other way you're going to get immunity is if you get sick.
Right.
And at some point, everyone will probably have either of those. And it's going to come down to the pace at which either of those immunity types start to go away. If either of those things start to go away while we still have virus that's capable of making people sick again circulating, then you have the chance of cases to increase again and another wave to come through. So when I look at the information that we have right now, and FDA and CDC, all the health agencies in the United States have just looked at this information specifically for the Pfizer vaccine, they're really seeing some pretty strong immune response still at the 6 to 8 month mark for most individuals. They're recommending that booster shot for some because, well, the elderly appear to start to have some of that immunity dropping off. And so that's why that's going to be recommended. And that way we extend the time frame for that group being protected, and we reduce the chance of having enough people that are losing their immunity to cause another one of those waves. So with the information that I see right now in Florida and for much of the United States, the combination of how many people have gotten sick and how many people have gotten vaccinated, I don't think we have the risk of a very new wave occurring soon. I think there's still definitely susceptible people out there, but really it's now another one of those things that we're going to be waiting and watching is how long that immunity is lasting for people out in the public.
When you talk about, Mike, natural immunity, I know that we've also heard that sort of the biggest protection you have is if you have natural immunity along with the vaccine immunity, which you take a chance, obviously, if you get the virus. What's the risk involved? Like, is it worth, some people have this idea that let it just run through the population naturally, and we'll take our chances with that. Is it worth it when you hear only 1% of the population is going to potentially die from this virus? Can you sort of explain to people why? I know that risk isn't worth it, but can you explain to people why it isn't, and how that 1% figure can be very, very deceptive, especially, in the US, you guys have now passed that 600, almost 700,000 death mark, really.
Yeah, so natural immunity, that term gets thrown around for someone who acquires the illness through nature, that they catch the virus in its natural form, and then they like we talked about, sometimes develop symptoms and sometimes they do not, and really that's one of the holes in this argument, is that the illness for individuals spans everything from very mild or no symptoms at all to ultimately death for other individuals. And that also is reflective of the level of immunity that they develop. What we're learning is sometimes people that have the milder response to the virus, they really didn't generate a very strong immune response either. And that natural immunity is actually going to wear off a little bit quicker for that individual than someone that had a more severe illness. And so that's one part of natural immunity that doesn't mean just because we let it go through the population that everyone's magically immune for the rest of their life.
Right.
That's one problem with that argument. The other really is the thought that only 1% of the population dies. That we're getting to about 1% mortality rate for the overall population, with all of these great control measures, with all of the mitigation techniques that we're using, with the healthcare system and the supplies that we have in our in our healthcare system. The second you let the virus run right through a population, you're going to overwhelm your healthcare system. So supportive care, all of those monoclonal antibody treatments or ventilators, all of those resources are finite, and only so many people can have them at a certain time. So you're not going to see 1% mortality rate. You're going to see 2, 5, 10%, because you're just going to have more people that are sick needing care than your healthcare system can care for. Not to mention all of the other heart attacks, strokes, and other things you won't be able to manage in your healthcare system while you let this natural immunity kind of move through your population. So the idea that it would only kill 1% is also not entirely, it doesn't hold up when you start to see how it would actually play out. And then really, even if it was only 1%, would you want that 1% to be your spouse or your grandma or grandpa that we're sacrificing for the purpose of moving through this quicker?
Right.
I certainly don't want to be the person that's voting that one person off. So yeah, for those reasons, I would push back against anyone who thinks that just natural immunity is the way to get through this.
Mm-hmm. I was reading a headline here. Would you have a question from Morin that says vaccinated versus non-vaccinated death rate in Florida? I don't know if you have any of that information available, but of course, we now know that Florida is sort of the epicenter of the pandemic in the US at the moment, really being driven by the Delta variant, and according to healthcare finance, also by the unvaccinated. What's going on in Florida specifically? Why is Florida leading the nation in the number of daily COVID-19 hospitalizations, during this surge?
Yeah, so our surge in Florida began right after the 4th of July holiday. We right after that point, we just saw that cases just started rising exponentially. And there really was kind of a perfect storm of situations kind of combining. So we already had a fair amount of virus kind of circulating in the community. So you had lots of people capable of spreading it. At that point, the previous versions of the virus had really been pushed out. It was almost all now Delta variant, which was 5 to 8 times more infectious than previous versions. And, we really kind of went with limiting nothing. I shouldn't have used the word limiting. A lot of the mask policies were removed. We allowed large events to happen again. And people, summer in Florida, lots of parties. It's actually hot in Florida in the summer. So people would actually go inside for a lot of stuff. So we're moving indoors during those months. So again, another bad combination with a virus that spreads better indoors.
Right.
So we just saw that those things combined, we saw very quick spread of the virus for about mostly through August. We're actually now about 3 weeks into a declining trend in Florida, and hospitalizations are now been decreasing for the last 2 weeks. And but we just had kind of all of the things combine to just cause a huge surge right in the July-August stretch.
Right. And just to give some figures to Morin, these are obviously dated. I'm just trying to look at the date here, but this was August the 16th. But it had at that point some, let me just find it again. Some 92% of inpatients for, again, COVID are unvaccinated. 8% were vaccinated. Children ages 18 and under represent 1 and 2% of inpatients. And in the health in the children's hospital system, they had 39 children in care as of that date, but 14 being in the intensive care unit. So again, I mean, the numbers speak largely to the fact that if you are vaccinated, there's a significant chance that you will not end up in the hospital. So that's, every single, graph I've ever seen from any country in the world supports that position. So again, that message to get vaccinated is based on factual information, really.
Yeah. And in Hillsborough County, the numbers that our team looks at, we were watching that kind of ratio of vaccinated to unvaccinated very carefully on a week-to-week basis. About 85% of the deaths each week are unvaccinated. About 15% have been vaccinated, and 85% of the deaths are unvaccinated. And when you look at the age difference, you're significantly younger if you're unvaccinated. You're in the ICU younger. You're in just the general hospital younger, and you die younger if you're unvaccinated compared to the vaccinated population. Some of those deaths that occur in vaccinated individuals are elderly. They're cancer patients. They have other health issues, but the unvaccinated are still 85% each week right now in Florida of the deaths.
Now, Mike, I have an interesting question here. I know that in Florida, it says that 90% of the doctors are vaccinated, but only 50 to 70% of nurses are vaccinated. What's going on, you think, with medical personnel who are refusing? They could otherwise be vaccinated, but are basically refusing to be vaccinated.
Yeah, this is something that we've seen actually for years. Going back to lots of efforts for trying to increase influenza vaccine each year, the uptake of influenza vaccine. We see that physicians and sometimes the doctors at hospitals or in nursing centers or long-term care type settings, the doctors and the physicians tend to have 90 to 95, 100% vaccination uptake. And the kind of further you go down the education chain, the more you see the vaccination rates drop. So nurses will typically see 50 to 70% vaccination uptake. And then when you go down to, the other support staff, the assistants, the aides, you'll see less than sometimes 20 to 30% vaccine uptake. And, there's a variety of factors at play. Some of it is that we tend to speak to the level of a physician about education for vaccines and the value, and we throw out terms like efficacy and effectiveness. We tend to talk over some individuals, and we're not messaging well enough at the education level that's understandable and relatable for some of the other staff. Some of it's cultural, some of it's general distrust for the authority, or they don't want to have to follow instructions. So there's a vaccine resistance is a very complicated topic, and there's a variety of reasons, but really one of the stronger predictors across almost any field is your general level of education. And we have to do a better job in public health of identifying that and working to speak to those populations better. It's right. Definitely something the entire public health community has to recognize and do a better job on.
Yeah. And I think that one of the things that has kind of undermined, when COVID came along, it was sort of the perfect storm, because for many years now, there's been this anti-vaccination movement kind of simmering. And there've been people sort of questioning the efficacy of vaccines, generally speaking, and how safe they are for people, in all populations. And there's just been so much misinformation and the advent of social media, where you can disseminate misinformation so incredibly quickly. I mean, it moves at the speed of lightning, right? But just to remind people that, we talk about the age being pushed down with the Delta variant and with the hospitalization rate. So in the state of Florida, just as another example, half of all the Florida COVID-19 hospitalizations as of August were under 55. So they're between the ages of 25 and 55. And then the hospitalization rate for unvaccinated teens is 10 times the rate for those who are vaccinated. So even your teens who are now eligible to be vaccinated, that sort of 12 to 17 age group, they're being hit incredibly hard by COVID as well. Now, Kevin, I see you've got a graph here for us that you'd like to share.
Yeah, just want to show some of the stuff that hospitals are posting. This is actual data coming from hospitals sharing on their social media. Again, this is dated back to September 15th. And if you actually go to Lakeland Regional Health's Facebook page, I downloaded this before it was updated, but they have some updated figures. But you could just see, again, it shows that vaccination is keeping people out of the hospitals. I'll just circle through a few of them here. That's for Lakeland Regional Health. You go to UNC Health Southeastern. That's in another state, I believe it is. And again, it's showing the same thing. It's not just in one area. This is data that's from all over the place.
Just go back to that previous one there, Kevin.
This one here, yeah.
Oh, yeah. So we have that first group, which is hospitalizations look like. So you had 4 individuals being fully vaccinated, 35 unvaccinated. And then the next group is, what is the middle group? What is that group for? ICU COVID.
Yeah.
Right. So you have no one in that group being fully vaccinated. And then the next group, which is ventilators. Again, no one in that group being fully vaccinated either.
Yep. And then we go to another hospital. This is, I believe, over in Ohio. Sorry, Oklahoma. Sorry, this is an Oklahoma hospital. Again, it shows that 65 people hospitalized with COVID-19. 86 of that is unvaccinated. 14% of it were vaccinated individuals. And they have, if you want to look at that note, 0 ICU beds available.
Wow.
They didn't have no space in their ICU. So this is one of those places where, sorry, we don't have space for you. And that was just September 12th. This is pretty recent.
So what happens if you are in that hospital and they need to move you to ICU? Where are you going to go?
Mike, that might be a question that you might be able to answer better than I am.
Yeah, I mean, they do the best with the resources they have. They are forced to do triage, make tough decisions. We've got 1 vent available and we've got 3 people that need it. Who has the greatest chance of a positive outcome if we put them on a vent? And the other 2 are kind of left out at that point. I don't envy the physicians in ICUs that have to make those tough decisions. But yeah, those are the decisions that happen when places get overrun. I mean, that goes to that previous comment that I had made about that.
Yeah. Wow.
And this is another hospital showing again when it comes to the unvaccinated versus the vaccinated. We go to a whole nother one, St. Charles Health System. Again, I mean, it's just saying this is all over the nation now, showing it's pretty much the same type of thing. If you're not vaccinated, you have a much higher chance of ending up in the hospital or getting on a ventilator and bad things happening, ultimate death. And that's one of the things in the Cayman Islands that we want to we don't want that to happen. The 2 deaths that occurred in Cayman, we want it to stay at that number. We don't want that number to increase one bit. We want to leave it right there. I know at today's press conference, I caught the tail end of it, and one of the things I know he was mentioning about this, he does not want to attend, especially one of the civil servants' funeral, if that was to ever happen. We don't want to scare people, but at the same time, we want people to wake up and realize that this is a reality that is going on in the rest of the world. And Cayman's not going to be exempt when COVID really becomes a little bit more of a thing there, when a lot of the different restrictions in terms of traveling is once that goes away, once those things are reduced, it's going to significantly have an impact on those who are unvaccinated, and we don't want that to happen.
Yeah. I know this might be, Mike, a little bit of maybe a political question. I don't know. Companies and organizations are mandating vaccines, or they're putting certain measures in place. So they're saying, right, we're not going to mandate it, but if you're unvaccinated, you have to be tested weekly for COVID. You have to wear your mask at work. They're putting restrictions on individuals, restrictions on traveling around the world, as we can see is now coming into play for the unvaccinated. Do you think that those measures are going to be effective in trying to encourage people to get vaccinated?
I think in order to address the multiple factors that go into the reasons people decide not to get vaccinated, we have to be approaching it with multiple solutions. Right. And incentives to get vaccinated are only going to work for a certain percentage of people, and you really kind of have to use the other side. You have to make things a little challenging to get to some others. Right. I'm not one that actually is for broad mandates for vaccination, but I think making it challenging if you're unvaccinated, I think is a really appropriate technique. If you want to not get vaccinated, you got to do these other steps, because I'm in charge of this company or this place, and I want to keep everyone healthy. So, reward the people that do it on their own, and make it challenging for others. I think we need to use every tool we have in order to help people, kind of help them make the right choice in the best ways we can. So I don't think there's a person that could argue that, using two techniques is maybe better than one. So right. That would be my approach if I was
to
make
360
decisions.
Approach, really. Yeah. Well, believe it or not, we are actually out of time. That hour went by very, very quickly. Mike, we'll just give you a few moments to give our audience some final words.
Yeah, thank you very much for giving me the opportunity to answer these questions and give some information about the COVID situation in Florida and prevention measures for everyone. And so really, if I didn't say it enough, the number one thing anyone listening today can do to keep themselves and their community safe is go out there and get vaccinated. And then I'll put in a plug for a different vaccine as well, as we're approaching influenza season. And so we don't really know what's going to happen with flu season this year. But again, every year we come on and encourage people to get that, because that's just another thing that can lead to hospitalizations and illness. And we want to reduce the burden on our healthcare systems right now. So really go out there, get your vaccines, and be proactive in encouraging families and family members, friends. If you convince one person, you've really helped your community out to get closer to this normal that we want to get back to. So.
Okay, well, thank you so much. Kevin, some final words? Absolutely.
So just again, want to remind people that every Tuesday, Thursday night at 7 o'clock Cayman time, we will be back with different experts that will be joining us. Of course, do follow us on the Cayman Mall Road Facebook page, as well as PIO Kevin W. That's my page as well, where I'm going to be sharing information there. Sandra is always sharing information there. So please be on the lookout for some of the upcoming topics that we will be having. We got a lot of really exciting topics that will be highlighted. I really appreciate your time tonight. And that's where I'll stop. Have a good night, Cayman.
Yeah, awesome. All right, Kevin, I'm sure I will see you in the morning on the morning show. Folks, again, thank you guys so much for tuning into the program. Fantastic program. I hope you guys learned a lot. Please, share the link if you were not able to join the program. We've already getting a lot of positive feedback saying that this was a great show. So do share the link with others. This is really all about trying to give you all information from experts from all over the world that we have been able to get access to. Again, thank you, Kevin, for your work. Paul gives you a big shout out, gives us a good shout out here. So yeah, I mean, do your homework, speak to people who are informed and in the know, rely on reliable information, not on, what your friends are telling you. It just, doesn't make any sense, folks, to buy into this stuff that, it's just misinformation. It could eventually cost you your life. So Wiese, thank you so much. Carol, thank you as well. Miss Rita, thank you guys for tuning in. Sharm was here, as well as Eddie at Denver and Miss Jackie. So we had a good crowd. Carol, Kenneth, Nancy, everyone who tuned in, took the time to listen this evening. We appreciate you tuning in, and continue to keep it locked here to Kimon Mall Road. Obviously, we'll continue to provide you with all the information that we can get our hands on. Have a good night.